Thank you for joining us on WRTV News at 6. I'm Amanda Starantino.
And I'm Mark Mullins. First tonight, hospitals and health departments across our area have been working diligently to vaccinate as many Hoosiers 80 and older as possible this week in the fight against COVID-19. As people wait their turn to receive the vaccine, people are trying to figure out when, where, and how they'll be vaccinated. WRTV's Stephanie Wade shares different counties' plans for mass vaccination sites and how to get your spot in line.
In Indiana, the state health department says people 80 and older have accounted for 52% of the state's COVID-19 deaths.
We've been looking forward to this for some time because of our age.
That's why they're among the first in line to be vaccinated.
By investing in, at first, this 3.8% of the population, we are reducing our death rate by more than 50%. That's our goal.
As it stands, people 80 and older, those who work in healthcare, and first responders are able to be vaccinated. After this age group, people 70 and older are next, followed by 60 and older. It's undetermined, however, who's after that or when we move into these different age groups. But what we do know is that the state wants at least one vaccination clinic in every county. On Monday in Hamilton County, they began administering the vaccine at the 4-H Fairgrounds in Noblesville. The Marion County Health Department is operating one of 9 sites at 38th and Lafayette Road. And today in Fishers, the health department administered their first COVID-19 vaccine at its temporary vaccination site and have acquired the former Marsh supermarket location at 116th and Brooks School Road for a mass vaccination site that will be operating by the end of the month and able to vaccinate up to 1,000 people per day.
You have to have qualified personnel to administer the vaccine, and then a lot of additional, really non-clinical volunteers to help manage traffic flow, to publicize the event.
Public health expert Dr. Kara Cecil explaining what it takes to open a vaccination site so quickly and why it's so important.
Those who are most at risk are least likely to be able to access the care when it is difficult to do in terms of hours of day or distance to receive that care.
Limited supplies of the COVID-19 vaccine also means every dose counts. Both the Moderna and Pfizer vaccines have to be used within 6 hours after a vial is opened. So what happens when those scheduled for shots don't show up? Most hospitals in our area say they are giving them to healthcare workers who are still waiting on their vaccination appointment. The state health department recommends having a standby list so no vaccine goes to waste. If you'd like to get on a potential waiting list, Dr. Cecil suggests calling your local health department. Stephanie Wade, WRTV.
Vaccinations are free. You can make an appointment online or over the phone by calling 211. Dr. Cecil says the vaccine has also proven to be helpful and effective in reducing the risk of contracting the new strain of COVID-19. If you do still get the virus, the symptoms are usually much less severe and you will likely recover more quickly.